Councilmember Triano.
Thank you. So as I echo, I want to thank you, Mayor Bowles, and your team. I'm very impressed by this budget. I think it's going to go a long way for the residents in the district. I guess I want to start off with one of the most vulnerable populations that have been dealing with a lot during this pandemic, and that's our senior citizens. And so I want to thank you for your commitment to them. One thing I am impressed about was the 6.9 million for internships for seniors. I hear a lot of seniors who are falling behind economically as the price of living in DC keep going up and up, and they're on fixed income. And I wanted to ask you: is this tied to the 50 plus program or to the senior community service employment program? How do we plan on doing outreach to ensure that those dollars are getting to the seniors they can get?
Well, thank you, Councilmember. You're right to focus. We know a lot of our seniors were already isolated before the pandemic, and this pandemic has increased social isolation. Seniors are providing care to grandchildren and to spouses. We have lost connection with our seniors who were going to wellness centers. So you will see in this budget ways to reduce that isolation, both in person, virtually, and otherwise. Let me ask Jenny to talk about you said the 50 plus program, and if we have anything that implicates that in the budget.
So we are expanding a variety of programs through DOES to provide all sorts of new job training slots and opportunities, including a lot of our federal programs that helps fund the 50 plus. I will have to get back to you, council member, on exactly how many slots that's creating though for 50 plus.
Okay, thank you. And also on education, we probably are going to see the most amount of learning loss we've ever seen in probably DC history. And while I'm impressed by the amount of money, in addition to the uniform per pupil student funding formula, I'm concerned about the 13 million investment into tutoring. I know we have ESSA, but I'm concerned that that's not enough to ensure that we are putting our dollars behind closing the achievement and learning gap in the district. Can you speak to that at all?
Well, let me assure you that we have put our best thinking around how to accelerate learning for children. And first and foremost, we have done across the government our level best to get kids back in person at their schools with their peers, with their teachers, and in buildings that have been set up to facilitate their learning. And we continue to be focused on that. This summer, also, we have a huge program that is both fun and enriching. And so there will be students who are going to school. There will be students who are in summer camp, thousands of students in summer camp. And let me give a shout out to DPR and its staff as well, who have been very, very creative about in-person opportunities. So I have to say that because they've been like, we want to get open because we want to see our kids, and they're doing great. And so there will be earn and learn opportunities for kids at DPR as well. I think we're at 13,000 kids in SYEP. There will be both in-person and hybrid experiences. Our entire cluster, led by Deputy Mayor Kine, has been focused on how all of those opportunities will help accelerate learning. So that not just getting into the next school year, but right now for the summer, we're focused on accelerating learning.
Thank you. I also want to echo that I'm appreciative of the money that's been put in the budget for violence prevention. That's needed, long been needed in the city. I do want to ask about the unemployment insurance and state EC. As you know, some of our residents are in some place where they're feeling depressed, left out, unengaged, and just not feeling like they're getting what they need. Is there any type of funding that's going to push to get more workers there to help relieve some of the stress on these agencies? I hear the director, Unique Merle Shoes, talk about the amount of pressure coming from the federal government with new regulations, which may slow down getting people their money. But there are people who haven't got their unemployment insurance in months, and so they're in dire need. Is there any emergency funds to get more staff to address that?
Councilmember, we have, the mayor has been investing in DOES using our federal stimulus funds, part of the $495 million that we first received, to add additional capacity to DOES. So we've added additional call takers, we've added additional adjudicators. We've also added improvements to the overall website itself for communication purposes. We do know that the system does need an overhaul, and there is money in the capital budget to do that. As you noted, it's just been an incredible amount of work thrown on the Department of Employment Services. And that funding to expand their capacity continues in this fiscal year.
And what about state DC to cover back rent?
State DC, I'm sorry?
Yeah, I get a lot of calls in my office that people fill out their state DC applications, but have got no responses from the government.
So one of the things we're working with the Department of Human Services on is making sure that we do step up the number of people who are reviewing. So what we want to do is make sure that with the resident applies, that they are getting a quick response. If the housing provider does the application first and the resident has to respond, we still need the resident to respond in order to process it. So with Stay DC, one of the things that just want to highlight is that we need to make sure that if a resident applies, that we get to that application quickly. If the housing provider applies, we need the resident to apply as well. Otherwise, we can't process the application. So we'll keep working to make sure we inform folks about that. But all the application reviews, once they're complete, we're going to work with the Department of Human Services to make sure that we're getting through those reviews quicker.
Thank you. One last question. United Medical Center is there. No, we are in a conundrum as it relates to that. Is there any thoughts or budget-wise about additional funding for United Medical Center outside of the receivership?
Kevin?
We will continue to provide funding to it, and our emphasis is in opening up the new hospital in 3 years. So we will be working with and responding to the new control board and identifying the funding needs that they deem for UMC. And that will become clearer as the coming months and the control board.
So I have to say something to that because, the control board is one of the cuts. And we're talking about 3 years, as you mentioned, for a population that has the highest health disparities in the district east of the Anacostia River. I'm concerned that we are not being proactive about putting money there to ensure that we can keep the hospital not just open, but vibrant, because a lot of seniors, that's their primary care physicians, et cetera, at their hospital.
Councilmember, let me assure you of this, that we will put before you what we need, and there are certain policy decisions that have been made by the council, and we will continue to work on keeping a full service quality hospital open until we get the new hospital open. If we have to come back to you and share with you the decisions that this board, and the control board is kind of a misnomer because these are all kind of our local people, so I want to be clear about that. It's a mechanism that was created locally, but it will likely force some tough decisions around personnel.
Thank you.
Council member, I just wanted to highlight one on your question about high impact tutoring. I actually wanted to provide some more context to it. So the $13 million that you identified is funding for FY22 in what we're building as a central capacity to be able to serve students across both the public and charter school. That will recur throughout over the next 3 fiscal years to be $41 million for this central capacity. Now, what's not stated there is the direct school funding that both individual schools and the charter and public schools get. And we expect, based on their spend plans, that they will, at the school level, supplement the central capacity, and we project the high-impact tutoring at that school level to be about at or above $100 million over the financial plan with this school-based work. So the central funding that we identify here is just one part of a larger amount that will come out of these school-based spending plans for the direct school federal grants. So just to give you a broader perspective to the depth of the investment.
Thank you, Councilmember. Councilmember Pinto?